Does addiction rehabilitation work? Someone asked me that. And I thought about it for a while and I said, does treatment for malaria work? What about high blood pressure? Welcome to Doctor BMS. Today I would like to talk about addiction rehabilitation as a treatment for rehabilitation. Does it work? Is it worth the while, or is it a game of chance? First, I would like to start by saying that in our country, Kenya, addiction rehabilitation is still a new concept. For a long time, when people have had problems with addiction to alcohol, to marijuana, to miraa, to prescription medication, and all things that people get addicted to, they have been sidelined from the mainstream of society, from the family. They have been shunned. They have been thought of as bewitched. They have been thought of as having made bad choices deliberately. So generally, they have been shown less compassion compared to someone who has malaria, for example, or who has high blood pressure. And because of this mentality around addiction rehabilitation and addiction as a disease, then people have been skeptical whether it's worth treating them, whether they are sick in the first place, and if it's good use of their time and their money. I would like to state this today as a correction of the notion that has been out there that addiction is a disease just like malaria, like typhoid. Addiction is a disease of the mind, and it does not matter how it came about. You may say someone started drinking deliberately, they were feeling they are successful, they have money, so they started, or a young person was introduced to marijuana by friends who misled them, and you as a parent or a relative, you caution them, do not smoke cigarettes, do not smoke marijuana, but they didn't listen to you. So they went down the path until they became addicted. It does not matter how it started, but once it has developed, it is a disease. It's akin to saying you buy someone a mosquito net and they refuse to use, or they choose not to use a mosquito net. They sleep without covering themselves with a net. When they get malaria, do you treat them, or do you say because you didn't use a net, you vomit and diarrhea and have fever until you die of the malaria? Ordinarily, we don't do that. And so, addiction is the same thing. When someone has used drugs to a level they have sunk into addiction, which means they have lost control of themselves and they cannot stop on their own, they need to be assisted. And the best way to assist them is to take them into rehabilitation. And so, to answer the question one of my viewers asked, yes, addiction rehabilitation works just like hospitalization for malaria or typhoid works. And this then means that there are people who come into rehabilitation and get well, they go out and change their lives and they live normal lives. Just like there are people who go to hospital with malaria and they get medicine and they get out, they're okay. But we have also people who come into rehabilitation and after rehabilitation, they go back to their old ways. We call it relapse. Just like we have someone who goes to hospital for malaria, they are treated, they go home and they experience the symptoms of malaria again. We've seen people with now COVID is the disease that is current. We've seen people who have been hospitalized twice for COVID. that does not mean that treatment for COVID does not work. So, treatment for addiction is rehabilitation. It works just like any other treatment, but there may be times it may not work for a particular individual. So the question then is, what makes a person benefit most from addiction rehabilitation? In what circumstances do we have it working more than other circumstances when the same measures are not applied? First and foremost, addiction rehabilitation will work if the person in addiction gets the right care from qualified, experienced caregivers. These qualified, experienced caregivers are most likely to be found in a rehabilitation center, and a reputable rehabilitation center for that matter. These are specialists who have trained in areas of body care, medical health, for example. They have trained in areas of mind care, psychology, psychiatry, counseling. They have also trained in areas of spiritual care. Okay. And the combination of care of the body, the mind, and the soul, BMS, body, mind, and soul, is what we do in rehabilitation. Next, you need to have a family, a support system for this person who has been brought into rehabilitation, which is enabling for the person to recover. This means you will not bring someone into rehabilitation and just dump them there, leave them there, and expect this qualified, experienced therapist for body, mind, and soul will do a magic and cure this person. No, we don't do a magic. We work with families to identify the important areas in this person's life which make him or her become addicted. Because the problem of addiction can be an inherited problem, but it can also be a problem that is acquired in our lives, in the society. So you could be going through a hard time, psychologically you are stressed. You could be having problems within your family, the workplace. You could just be someone who did not get good guidance when opportunities for you to use drugs of addiction came your way, like you made some money or you moved to a new job location and you are with friends who are influencing you in that direction, but you lacked a mentor or someone, a guardian who can help you by balancing, to do those things that will harm your health. So there are many things that can cause someone to go into addiction. And we as therapists would not know right away without the support of the family. We want the family to come in and tell us the life story to corroborate what this person is saying, because sometimes when they come in, they may not give the full story, or sometimes they may hold back some things. So we want that. But also, we would like the family to learn how to support this person when they leave the rehabilitation center, because eventually they will leave the rehabilitation center and go back to their families and the society. So the family input is very important. Third, and also important, is what happens after someone has left rehabilitation center. So you've come in, you've gotten good caregivers, the family has been involved well, but when you go out there, we require that your environment be modified in such a way that it does not support the old ways. If you are someone who was engaging in drugs of addiction because you didn't have a good way of spending your time, We want to change and make you have a good way, a better way of spending your time. If you are idle, you probably would benefit from a bit more engagement. If you are having family issues, personal issues, work related issues, then we would like to solve these issues or help you solve these issues so that when you go out of rehabilitation, they are no longer there and they don't act as a trigger for you to go back. Okay. Lastly, we would like to give information to you, the person who is in rehabilitation, and the whole family so that you know what to do to stay away from addiction as opposed to what you are doing before. And so this education is an important ingredient in making someone leave rehabilitation with more awareness and more stability, confidence that they can go out and stay sober. When these things have been taken care of, put in place, and someone comes into rehabilitation, spends the prescribed time, in Kenya on average is 3 months. Some centers do an accelerated program of 1.5 months, 6 weeks, but 3 months is average in Kenya. Worldwide, it's often more than 3 months, where resources can allow people stay in rehabilitation for 6 months, 9 months, 1 year. The longer you stay in rehabilitation, the better for you, the more the prospects that you will go out and not relapse back into addiction. So when all these things have been done and you've stayed in rehabilitation long enough, chances that you will go out with a full cure and not relapse are very high. And in that case, then we can confidently say, yes, rehabilitation works just like treatment for any other illnesses humans may have. But if we do not take care of all those considerations, then we start losing that chance that you may have a full rehabilitation, and sometimes we get relapses or people going back into their addictive ways because some things may not have been done. Thank you very much.